An estimated 1.3 to 4 million people around the world get cholera each year, and 21,000 people to, about 143,000 people die from it. People who get cholera often have mild symptoms or no symptoms at all, but cholera can be severe. Now, we understand that approximately 1 in 10 people who get sick with cholera would develop severe symptoms such as watery diarrhea, vomiting, and leg cramps. In these people, rapid loss of body fluids leads to dehydration and shock. And the terrible thing about this is that without treatment, death can occur within hours. Hello and welcome to the Spotlight on Food and Health Communications, your number one go-to media source for credible and timely health information. Victor Watery is my name. On today's episode of the Spotlight, we will be focusing our lights on the cholera disease. What is the cholera disease? What are the signs? What are the symptoms? And what are the tips that you can take to preventing yourself from having the disease? Remember, prevention is actually better than cure. Now, all this and more we will be discussing when I come back from this break. Please stay with me. Welcome back. It's still the program Spotlight on Food and Health Communications, your number one go-to media source for credible and timely health information. Today we're talking about the cholera disease. The big question is, what is cholera? Well, we understand that cholera is an infectious disease that causes severe watery diarrhea, which can lead to dehydration and even death, even treated. Now, cholera remains a global threat to public health and an indicator of inequity and lack of social development. Where is cholera found? Well, we understand that the cholera bacterium is usually found in water or in foods that have been contaminated by feces from a person infected with cholera bacteria. Cholera is most, likely to occur and spread in places with inadequate water treatment, poor sanitation, and inadequate hygiene. Now, cholera bacteria can also live in the environment in brackish rivers and coastal waters. Shellfish eaten raw, have been a source also of infection, and we understand that rarely people in the United States have contracted cholera after eating raw or undercooked shellfish from the Gulf of Mexico. Now, how does a person get cholera? A person can get cholera by drinking water or eating food contaminated with cholera bacteria. Now, in an epidemic, the source of the contamination is usually the feces of an infected person that contaminates water or food. Now, so many times people talk about how that people get the cholera disease by, talking to someone who has a cholera disease, by, shaking hands with someone who has a cholera disease. All that is not true. The only way you can get the cholera disease from a person who has the cholera disease is if you take, a water or a food that is contaminated by a person who has the cholera disease. Now, the disease can spread rapidly in areas with inadequate, treatment of sewage and drinking water. Now, if you live in a place where the treatment of water is poor, the treatment of food is poor, there is a high chance, a high risk of actually getting contaminated by the disease. Now, the infection is not likely, to spread directly from one person to another, just like I said earlier. Therefore, casual contact with an infected person is not a risk factor for becoming ill. So, if you have someone who's down with the cholera disease, it doesn't mean you have to necessarily isolate yourself from the person, because it cannot be spread by a direct contact. Take that as a notice and debunk, those heresies that are being spread out there. Now, what are the symptoms of cholera? Now, cholera infection is often mild or without symptoms, but it can actually be severe. Now, Approximately 1 in 10 people who get sick with cholera would develop severe symptoms such as watery diarrhea, vomiting, and leg cramps. If you notice some of the signs, the signs of leg cramps, the signs of vomiting, the signs of diarrhea, you might just have contacted the cholera disease. Go see your doctor immediately. Now, in these people, rapid loss of body fluid leads to dehydration and shock, and without treatment, death can occur within hours. So when you contact the disease, you begin to dehydrate because you start stooling, and in stooling you are actually losing fluids, and if you keep on losing fluids to high magnitude, you can actually get to the point where there is a shock, and without treatment it can actually lead to death within the space of just few hours. Little wonder how people complain of diarrhea, complain of vomiting, stooling, and before you know it, they are gone. So please, if you notice some of those signs and symptoms, hurriedly go see your doctor. Now, how long after infection do the symptoms appear? Now, it usually takes 2 to 3 days for symptoms to appear after a person ingests, cholera bacteria. But the time can range from a few hours to 5 days. Now, who is most likely to get cholera? Listen to me very, very carefully at this point. Now, persons, living in places with unsafe drinking water, poor sanitation, and inadequate hygiene are at the highest risk of the cholera disease. If you are living in places where the sanitation level is low, if you are living in places where, the treatment of water is low, if you are living in places where there is poor sanitation, inadequate hygiene, you are actually at the highest risk of contracting the cholera disease. Now, what should you do if you know someone who has gotten sick from the cholera disease? Now, if you think you are a member of your family, any member of your family, might have the cholera disease, the first thing you need to do is seek medical attention immediately. Now, dehydration can be rapid, so, fluid replacement becomes very, very essential. If you have oral rehydration solution, otherwise known as ORS, start taking it immediately. It can actually save a life. Now, continue to drink ORS at home and while traveling to get medical treatment. Now, if an infant has watery diarrhea, the first thing you need to do is to continue breastfeeding. Very, very important. Or residents in an area where cholera is occurring or has occurred should follow recommendations to prevent getting sick. What are the recommendations? Number 1, drink only bottled water. Drink boiled water. Drink chemically treated water, or bottled canned beverages. If you want to drink water, drink only bottled water. That's if you know you're staying in a place where the epidemic of the cholera disease is high. If you want to take, beverages, take only canned beverages. Only canned beverages. Now listen, when using bottled drinks, now, make sure the seal has not been broken. It's not enough to say, yes, I'm drinking, canned, drinks, taking bottled water. Ensure the seals of this water, this canned drinks, have not been broken. Now, carbonated water may be safer than non-carbonated water. So if you have the chance of taking carbonated water, if you can go the extra mile to take carbonated water, go ahead and take them. Now, avoid tap water, fountain water, and ice cubes in places where the epidemic is high. Now, I'm not trying to say that tap water is not good, fountain water is not good, but if you are in a place where the epidemic is high, try as much as possible to avoid tap water, fountain water, running water. Now, if you are going to take your own water, here are some things you need to do. You need to disinfect your water. And this is some methods, some options you can take when it comes to disinfecting your water. Number 1, boil your water for at least 1 minute. Boil your water for at least 1 minute. Or filter it. If you can't boil your water, ensure you get the water filter and filter your water. Filter your water. What else can you do? Use commercial water, chlorination tablets according to the manufacturer's instruction. So if you are not, using the filter, if you are not boiling your water, if you want to go for, the chemical chlorination, use it according to the manufacturer's stipulated instructions. Do not take things the way you think they should be. Go according to the doctor's or the manufacturer's prescription. Now, what other measures do you need to take to avoid the cholera disease? Wash your hands often with soap and clean water, especially before you eat or prepare food that are ready to be eaten. Wash your hands before you prepare this food or before you eat this food. Ensure you wash your hands. Now, what else do you need to do? If no water or soaps are available, use an alcohol-based hand sanitizer, with at least 60% alcohol. Now, used bottle, boiled or chemically, treated water to wash dishes. If you want to wash dishes, yeah, it's that high. Now, all this apply to people staying in high, areas where the epidemic is high. Before you're asking me, Victor, what do you mean? Do you mean I should be using bottled water to wash my dishes? That's not what I'm saying. I'm saying that if you're living in places where the epidemic is high, in order to steer clear from the cholera disease, you need to be more protective. And in being more protective, you can actually use bottled water, boiled water, or chemically treated water to wash your dishes, to brush your teeth, to wash and prepare food, and to also make ice. Now, eat foods that are packaged or that are freshly cooked and severely hot. Cover your foods. Do not expose your foods. And if you must eat, ensure your foods are well packaged, not exposed, to flies, to the air, to breezes and all of that. Please take these measures. They are very, very important. What else can you do? Do not eat raw or undercooked meats and seafoods, or raw and undercooked fruits and vegetables unless they are peeled. So, if you must take fruit, ensure these fruits are peeled. That's the only reason why you must take a raw fruit. The fact that you can peel it out to take what's inside, regardless of the fact that you're not peeling it, please do not take raw fruits, raw vegetables. Try as much as possible to take things that are cooked, because in cooking them, you kill the germs. In cooking them, you kill the disease. Okay? Now, last but not the least, finally, dispose of feces in a sanitary, dispose all your feces in a well sanitated manner. If you're disposing feces, trashing your things, do them in a well sanitary manner. Do not just, expose your feces, expose dirt here and there. They can actually affect your water. They can actually go ahead to affect your food, or even your water or your food sources. Okay? And I can assure you that if you take all of those measures, if you take all of these things we've talked about today, my friend, the cholera disease will be far away from your doorstep. And this is where we let down the anchors. On today's episode of the Spotlight, we have talked about cholera disease. We have seen what the cholera disease is. We have seen what the signs, what the symptoms are, and what are the tips you can take to ensure that the cholera disease is far away from your doorstep. I tell you, certainly, if you had heard from all this, tips coming from the decks of the food and health communications, if you do this, you're going to be far away from the cholera disease. Till I come your way next time, my advice to you is keep staying healthy, keep staying safe. And lest I forget, do well to subscribe to our YouTube channel if you have not subscribed. And if you have subscribed, and go ahead, and like our videos. And if you have thoughts, contributions, questions, do well to leave us in the comment section below, and we will do well to reach out to you. Till I come your way next time, my name is Victor Watery. Keep staying healthy.